Okay, good morning, everyone. We are going to call the meeting to order. And our first agenda item is approval of the Zoom video from March 17th, 2022. Sorry about that, for the Board of Health meeting. So can I get a motion to approve a video as minutes?
Move approval.
Thank you, Dr. Ross. A second?
Second.
Thank you, Dr. Jeffra. So I don't believe we need to actually do a person-by-person vote, but if there's any objections or changes, we can just note that in the chat. But we'll note that as unanimously approved and then move to our next agenda item.
We should call for this a formal vote, yay or nay, for approval of the minutes.
So my only question is, can everyone unmute to do that? And if not,
or they can raise their hands.
Okay, and if not, you can type in the chat or raise your hand. So we'll call for a formal vote to approve the video. All in favor?
Aye.
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 Okay, opposed? Abstentions? Motion carries. Thank you. So we'll move to our next agenda item, which is the COVID-19 update from Dr. Mahdi.
Thank you so much. I will start to share slides. Sorry. Apologies, folks. Can everyone see the slides?
Yes.
Okay.
To your screen, but not full screen slide.
And now are you seeing the notes page or the regular page?
That works.
Looks good.
Regular.
Okay. So good morning, everyone. Pleased to give you this COVID-19 data update. Many thanks for Matt Haslam, who prepares these slides and who also oversees this data for us and has been doing a phenomenal job throughout this pandemic. So we're going to start today in a little bit of a newer area than you usually see us with the sewer shed surveillance. So recent sewer shed surveillance data shows decreasing viral load in wastewater for a few surveillance sites in the St. Louis region. This is indicated by the green circles on the map to the left, and two sites with increasing viral load you can see as indicated by red circles. Yellow circles indicate no change. Despite the increasing trends for those two sites, neither site has had statistically significant elevated viral load. So this is the viral load across Missouri surveillance sites. Viral load in wastewater correlates strongly with diagnoses and is a helpful surveillance tool to estimate the true extent of the pandemic across the state, especially as testing data has become less reliable of an indicator. We're just seeing less and less people get PCR testing. We think this is partly due to pandemic fatigue and partly due to people using antigen tests more and more, for which, unfortunately, the federal government did not institute a reporting structure. And so that has made it difficult. Currently, viral loads across Missouri are very low compared to previous months, but a small number of sites have begun to see increasing trend in April of this year. This could be an early indicator of increased transmission in our region, and definitely something that we're keeping our eye on, given the fact that we have seen an increase in cases in many places across the country. So now I want to start to familiarize you with this new CDC community level metric that we have been using since the CDC shifted its approach to reporting. So the city of St. Louis has updated its COVID-19 dashboard to provide the 3 metrics recommended by the CDC for the public to follow the city's community level. And this is represented by a 7-day case rate, 7-day hospitalization rate, and a % of hospital beds occupied by COVID-19 patients. Currently, the city is in the low risk category. So here we'll look at the St. Louis City COVID-19 epidemic curve. The 7-day case count average was flat for the entire month of March, but April has started to see an increase in the number of daily cases. The average daily case count more than doubled over the past 4 weeks, from a low of 9.4 cases per day on March 18th to 23.7 cases per day on April 15th. While the overall levels remain low, it's worth keeping a close eye on the data because the increase may be the beginning of the next wave. Here we're going to look at the COVID-19 case density by ward and neighborhood. So transmission has been cooling off across the city, but some areas are seeing an increase in activity. The brightest spots can be found in the Central West End and Midtown neighborhoods. Proximity to the BJC and SLU hospital systems may be contributing to these clusters. Testing volume has decreased broadly, but major hospital systems continue to do routine testing of staff and patients, meaning they will now play an increasing role in surveillance of COVID-19 in the region. So this slide takes a look at COVID-19 case demographics by race. African Americans have been disproportionately affected by COVID-19 throughout the course of the pandemic in the city, as you know. However, in February, Caucasians made up the majority of new cases for the first time, and this trend has actually continued into the spring. Asians also saw an increase in their proportion in March and April. So if we look at COVID-19 case demographics by age, in April of this year, the proportion of new cases in age groups of those age 60 and above decreased compared to the month prior. This is a reassuring trend because the elderly population is at highest risk for adverse outcomes. Young adults, age 20 to 39, make up more than half of all new cases. Here we're looking at, we're going to shift to looking at our vaccinations. So vaccination in the pediatric population, age 5 to 17. Currently, 49.2% of eligible school-age children have received at least one dose, and 41.1% had completed the primary series. Children living in predominantly African-American zip codes have a much lower vaccination rate. 32% received at least one dose compared to 71.2% of children in predominantly Caucasian zip codes. Inequities in vaccination rates may exacerbate other health or socio-developmental inequities because those unvaccinated children are more likely to suffer from secondary consequences of COVID exposure, like time lost in learning. Here we look at the vaccination rates initiated, completed, and boosted. The number of first, second, and third doses being administered has decreased to a slow and steady pace. The city of St. Louis is now 62.6% fully vaccinated in the eligible population of those aged above 5, and more than 1 in 4 eligible residents have received a booster dose, and that's aged 12 and above. These rates remain well below target levels to achieve herd immunity, which is why we continue to have such a strong push. Some adult populations were recently given approval for a 4th dose to maintain immunity levels. So we've started a campaign to really push for the booster in these age groups. Here we're looking at vaccination initiation, first doses by age group. Vaccination initiation continues to slow but surely improve across all age groups. The most room for improvement is the youngest age group, 5 to 11 years old, which only has a 35.6% initiation rate. Here we look at vaccination initiation of the community by geography. Zip codes in North St. Louis continue to lag behind the Southwest zip codes in overall vaccination rates. You can see that on the map in the left, but we have generally had faster rates of change in recent weeks compared to Southern zip codes. So our real big push to advocate for those zip codes is slowly but surely paying off. And so that shows that we are actually closing the vaccination gap slowly, but we are getting there. So a little report on our neighborhood vaccination clinics. As you know, DOH has been holding small neighborhood clinics to bring the vaccine to where people live. The purple pins on the map show DOH-sponsored clinics to date in the month of March and through the first half of April. At these clinics, DOH has administered 907 doses. In addition, DOH has been working with vaccinator partners like our FQHCs and school districts to administer vaccines. A total of 1,574 vaccines were distributed by partners during the same timeframe. So we're very pleased about that. In an attempt to be innovative, we're doing a few more things. We're now focusing on certain at-risk groups, the unhoused and the elderly age groups, where we're taking vaccines directly to them. We have also partnered with BJC and the Center for Implementation and Dissemination at WashU to call residents within the city, encouraging them to get vaccinated, addressing any of their concerns. And then if they are interested in vaccines, using a mobile van to take vaccines directly to them and providing them with gift cards from the Department of Health. So we continue to be thoughtful, innovative, and really address this issue around vaccinations. So let's shift our attention to hospitalizations. The number of currently hospitalized COVID-19 patients is the lowest it has ever been since the pandemic task force began tracking in March of 2020. Vaccinations are the best resource that we have to reduce the risk of hospitalizations. This shows immunity gained through vaccinations through natural infections is likely contributing from the last dramatic surge that we had. However, hospitalizations are a lagging indicator, right? So as we're starting to see an uptick in cases, we wouldn't expect to see that reflected in hospitalizations for a little bit. So any increase in local transmission may take up to several weeks to translate to an increase in hospitalizations. So now to just provide you with a report on the new Omicron variants, we have two sublineages, BA.2.12 and BA.2.12.1, as well as the XE. The new sublineages of Omicron have been discovered and are contributing to rapidly rising case counts in parts of the Northeast. Initial reports suggest they may be up to 20% more infectious than the original strain of Omicron, BA.1. New York City is once again at the forefront of these new variants, but BA.2.12 has already been discovered in wastewater in St. Louis County. A third variant, dubbed the Omicron XE, is a recombinant strain of BA.1 and BA.2, meaning a person was infected with both strains at the same time, and those two strains intermingled, swap mutations in the host cells. Prevention strategies for dealing with these variants remain the same. Vaccination, strongest tool in our toolbox. Boosting especially. Social distancing, hand washing, wearing a mask indoors, frequent and inadequate ventilation continue to be our best way to address these. And we have continued communications to that extent. And I think it's important for understand that these new variants may postpone an endemic state. There's been a lot of chatter about how the pandemic is over, people throwing around the word endemicity very casually. But that is not where we are at. We are still very much within a pandemic. The City of St. Louis, the Department of Health continues to monitor for activity of new variants of concern. I gave you the statistics around these variants. Much discussion is taking place about transitioning from a pandemic to an endemic state, where the virus would be continuously circulating at low levels. Many jurisdictions are moving towards this new normal, right, as it's been dubbed, and are removing restrictions to reflect the currently low levels of transmission. But as the BA.2 variant and subvariants remind us, the virus will continue to mutate when allowed to circulate in viable hosts, especially in the absence of herd immunity. So we should not give in to the temptation of ignoring the virus, and we must maintain these robust surveillance for potential spikes in transmission activity. As part of my report today, I will be talking to you about our joint initiatives with the county, and more on how we are addressing this will be addressed at that time. But for this time, this is the end of my COVID-19 update for today, and I'm happy to entertain any questions.
Thank you, Dr. Mahdi. Do we have any questions? I see Dr. McBride, your hand is up.
Thanks, Dr. Mahdi and Matt, for the great report as usual, and generally good trends. On the CDC thresholds for low, medium, high, do you know offhand what those thresholds are, how close we are to moving from low to medium? I can probably look it up, but I was curious.
You're on mute still, Dr. Mahdi.
Thank you. I don't know them offhand, and I don't see Matt on the call this morning, but I had a conversation with him. One of the things that we are seeing is the CDC is actually really trying to do a good job of providing us with more metrics that can help us not only understand where we are, but where we're headed. So there's a set of metrics that we'll be updating our dashboard with as early as Monday of next week that also tell you, where are you headed? Like, what are the projections for where you're headed because of, of the way data is progressing in your region. We are in the moderate zone for that. And so that would lead me to believe that we are close to the threshold. Matt is here because he has now he's put a link in the chat and is always here to support me. Matt, do you have anything to add to that question?
No, so the specific thresholds, the first one is by cases per 100,000. And so the threshold for that is 200 cases per 100,000. And on the slide, I believe it said we're at around 53. So we're well below that threshold right now anyway. But that's a little bit, it's tricky, right? Because there's less testing going on. So we're probably missing quite a few more cases now than we were before. So we have to be a little bit careful about using that too much. And then the new COVID admissions per 100,000 over a 7-day period, the low threshold is below 10. And then the percent of inpatient beds staffed by COVID-19 patients is also below 10%. And currently we're very low at about 1.5 or 2%. So right now the data looks pretty good, but as Dr. Mahdi mentioned, we are seeing a little bit of an uptick in cases, and how dramatic that rise is remains to be seen, but we're definitely keeping an eye on it.
Excellent, thank you.
Question. Sorry, the data on the pediatric population was really sobering, with 32% vaccinated. Where are we in terms of actually having school-based vaccination efforts?
Yeah, that's a great question. I meet weekly with the school leadership, including the superintendent for SLPS, the leadership of the Archdiocese schools, charter schools, and independent schools. We have asked them to really join us in re-upping partner vaccinations. They were a great partner to us at the beginning of the pediatric rollout, so we would like to see that happen. One of the challenges, however, is that you saw that the disparity is greatest within the Black community, specifically in the North region. So we'd like to focus our attention on schools in that region. I've also sent out a call to the Board of Aldermen, especially those in those zip codes, to please work with us to partner around vaccinations. I've had a meeting with the Urban League leadership of St. Louis. They continue to do a phenomenal job of meeting this challenge, and we will try to support them as much as possible. Lastly, the FQHCs continue to try to increase communication, education, and access, especially in those areas. But I think in regards to schools specifically, we have asked the school leaderships this week and last week. I've had 2 separate meetings with them to really reach out and partner. I'll be honest with you that response has been low to date. They're also feeling a lot of the challenges of the times around where this is moving, and the demand, as it were, from parents within schools. But we will continue to have those conversations and try to increase those, because I believe that would be one of the best ways that we can get this done.
Well, good luck with it. We certainly need.
Thank you. Are there any other questions? So Dr. Mahdi, I think you kind of gave a preview of our next agenda item. So if you would like to proceed to give us an update on the partnership with the St. Louis County Department of Public Health.
Absolutely. Okay, are you seeing the correct screen?
Yes.
Okay, great. So I was asked to give an update on a new monthly meeting that I initiated when I took this position as the Director of Health in October. So back in September, right after I announced, Dr. Faisal Khan and his team were gracious in being the first human beings out of my family and friends to reach out, congratulate me, welcome me, and request some time to just say hello and to see if I needed any support. It was an incredible gesture at a time, as you can imagine, that things can be overwhelming stepping into a position. So at that time, I asked them to please meet with me and our respective boards monthly. My hope was to have a unified, a more unified approach to leadership within the region, and for us to give each other, updates on what we're doing independently, and to collaborate as much as possible where we can. And so we have been doing that consistently since November of last year. Dr. Khan and his team immediately accepted my request and have been gracious in taking on the administrative scheduling for those monthly meetings. We create our agenda beforehand. And like I said, the leadership of both of our departments of health and the leadership of both of our boards meet monthly. The goals of those meetings initially were to have an agenda-based consultation or conversation between our respective leadership, again, to foster that spirit of collaboration and support. But most importantly for me, the vision was to unify the region. It can be very confusing for folks when we're literally right next door to each other. It's not like there's a magic line that separates us, to have different policies in place. And this showed itself to be immediately impactful. As I told you, one of the first things that I had to deal with when I came in was the pediatric rollout. And one of the first pieces of feedback I got from school leaderships as I reached out to meet with them was how difficult it was for them to deal with seemingly conflicting policies around COVID-19 at the time. Quarantine at the time, isolation and quarantine times in the city were 14 days, 10 days in the county. There was a test to stay, test to return option for county schools, not in the city. So just having that meeting with the schools and immediately being able to meet with my counterparts in the county meant we could have a discussion about where we stood on this issue. And within 2 to 3 weeks, I was able to update policy actually right from scratch, because the policies did not exist in DOH when I came in. Policies to address how we would move forward with isolation, quarantine, test to stay, and test to return. So one of the immediate examples of how this was fruitful, we were able to immediately work together, share resources, and have policies that were unified for the region. So I'm going to walk you through some other examples of how this has been fruitful. We 2 years ago, just over 2 years ago, the city and the county both signed an initiative to partner with the Fast Track Cities initiative that brings together the city, the county, health departments, the mayor's office, and local community groups around a common goal of ending the HIV epidemic. Throughout that time, Fast Track Cities has operated and has not really had a time when they have seen the leadership come together in a unified way. Because of this new monthly meeting, we were able to address that and really all come together. I was able to welcome Dr. Faisal Khan to our December 1st celebration of Fast Track Cities of the signing period. And we were able to really come together in strength to address this really important initiative. February 11th of this year, we came together for Heat Up St. Louis, Rise and Shine. February 25th, the county invited the city to join them in addressing legacy stories from the descendants of the Tuskegee experiment as part of Black History Month. They did a phenomenal job in putting together this program, and we were again able to be unified in addressing this very, very serious history of systemic racism that has plagued Black communities to this day. We have been working together on community health assessment meetings, and that showed itself in a physical way in March of this year. We have been sharing resources around getting reaccredited, and the city has procured a consultant to help both the city and the county towards this goal. The county has shared huge resources with us around getting to this goal as well. We have recently met to sort of talk about where we are, what the challenges in bringing two very different health departments together who have different schedules as far as accreditation and how we can, move this forward. Had honest and open dialogue about some of the challenges, and it really helped us to reset and move forward. I'm very appreciative for that type of approach. We also have worked together on narrowing the racial equity gap in COVID-19 with the St. Louis Metropolitan Medicine. And we have been placing COVID-19 clinics in neighborhoods as a success story of how we have actually come together in many ways as well here. One of the most important things that we have done together, historic really, is join together in writing policy. So on April 11th, we released the Living with COVID-19 policy statement because we really felt that it was important to really help the public understand what the new normal would look like, especially at a time where there's so much conflicting information, certain political entities declaring the pandemic over, people, again, like I said earlier, using the word endemnicity very casually. And so we wrote a document of which I'm very proud. If you haven't had the opportunity to see it, I'll ask Kim to please put the link in the chat now for you to be able to see that and really go through it. We really addressed how the public should be thinking about the new normal from an individual, community, and other levels, with a level of detail but succinctness that I think is enormously helpful, and we've got a lot of great feedback about this. So I'm enormously proud of this particular venture together. We released a joint press release around it, and both of our social media teams did a campaign around notifying people about this. And again, this policy statement and document is up on both of our websites for the public. Other things we've done together, in honoring National Black HIV/AIDS Awareness Day, we came together to have a beautiful community-based conversation. If you've ever watched The Shop by LeBron James, where he speaks in a barbershop, invited guests, we had the St. Louis version. We were in a beautiful Black-owned barbershop with I can't even describe how intentional the artwork and the vibe was, and brought together leaders, community members to have such an important conversation around this topic. April 15th, we also then did a second release joint effort to address the rise of STIs in the region in light of the latest CDC report. And so that went out by way of press release and more information on our website. You'll be seeing from the city a lot more information around STIs on our social media platforms tomorrow and in the coming weeks in addressing this very important issue as well. So what's next? Well, one of the things that was very important to me is, as you may or may not be aware, there has been a complete change in leadership in DHSS at the state level, where the prior head and vice head were recently left the DHSS, and a new interim head came in. Transitions are always hard. I'm sure people can say the same of my transition coming in as well, in that you have to get to know someone, rebuild all the relationships. And we were having a tough time getting access to the state. And so I reached out to Dr. Faisal Khan and asked if he would be interested in joining me to meet with the state, if we could procure a time to meet with them. And so the mayor's office was gracious in interceding and getting us this meeting. I had an initial meeting with the new interim leader, who was everything by way of being open, willing to work together, and was able to really give her a robust history of what's happened in the city and where we are specifically in regards to COVID-19, our concerns, and what we'd like to do. Made it very clear that Dr. Faisal Khan and I are committed to working with her and her team to make sure that we can help not only the region, but the state move forward responsibly and impactfully with where we are now and where we need to go. She has since reached out to meet with both Dr. Faisal Khan and I, and we are scheduled to meet in the middle of May with her for a more in-depth meeting that Dr. Faisal Khan has graciously hosted us at the county for that meeting. We will also be having a joint in-person meeting. This was supposed to happen over a year ago, and then, over a year ago now. but COVID prevented it from happening, where our joint boards of health and our leadership will meet and fellowship together. And then, in general, what we are hoping is that the momentum we have already built in such a short space of time will explore the feasibility of a unified Department of Health in the future. So I will stop here and entertain any questions or conversation that we can have around this.
Thank you, Dr. Mahdi. Questions, reactions, feedback?
I have one reaction. Kudos. That was a fantastic report. Really shows a remarkable amount of progress and our, excuse me, remarkable vision for the city and the county. So we're just in awe, and we're 100% behind that effort.
Thank you so much, Dr. Ross. May I just acknowledge that it was Dr. Ross who first, years ago, Dr. Ross, and I'll introduce this, but I would love for you to give folks some history on the role that you played. Dr. Ross saw the necessity of this work a long time ago. In fact, put pen to paper to put a robust policy or roadmap, as it were, as to how this could happen. And so having him join us at these monthly meetings by way of mentorship and leadership has been truly important as we continue to try to move this ahead. So Dr. Ross, I would love for you to just speak to where you were with this, what your hopes were, and so that folks can really understand maybe how we want to support this vision moving forward.
I'm not going to say very much because you said it all, Dr. Mahdi. I actually goes back even further, 1997, when I worked with Mayor Clarence Harmon on a report of the health department, and concluded that we had a lot of redundancies, and followed up with a report in 2014 on a shared service model. And I think all of us as board members and staff should be able to have access to that, because it was a nonpartisan effort, pulled in a lot of data with a remarkable group of people across the spectrum, and really just tried to give a vision of where we need to go in terms of having a shared service model. So that's all I have to say. I just rested on the leadership of the city and the county boards of health to carry that forward. Thank you.
Thank you. And so for us, it's very important for us to honor that and to really move this forward in tangible ways. We want to be able to show how successful and how impactful this can be. So our next goal is to hopefully start to put metrics around what we're doing and be able to really measure impact as we try to move forward upon the foundation of the work of Dr. Ross and many that came before us. But I will open it up to any further comments, questions as well.
So I think Dr. Ross's comment about making sure that we all have access to that specific report is very helpful. I've been thinking about our current committee structure and how it aligns with the work of the different bureaus and departments, and how we can be more intentional in what we bring or offer to support the health department and moving your multiple streams of work forward. And because we are starting to think about having joint meetings, joint conversations, the more information we have about what a roadmap already looks like, I think that can really help accelerate our ability to partner. So thanks for offering that suggestion, Dr. Ross. That makes a lot of sense at this juncture. Are there other questions on this topic? If not, we will move to our next agenda item.
Thank you all for the support in the chat. I see it and it's very encouraging. Thanks, everybody.
Our board committee reports. And our first report will be from the Governance and Nominating Committee.
Thank you, Serena. Good morning, everyone. I apologize for having my camera off. This is Linda Racklin. I'm down with a cold, flu, cough, infection, not COVID, thankfully. Thank you very much to all board members for completing a very short survey we sent around, assessing whether or not you would be interested in participating in a board orientation and training session and the topics you would like to see covered. So Dr. Mahdi, almost all of our board members have completed a short survey. we as a committee will digest those responses and get them back to you so we can go ahead and plan a short orientation training session for our new members and anybody else who'd like to participate. So I think that's our committee's main work in the past month. And I'd like to just join others and thank you for your tremendous report and all of your great work. Happy to take any questions or address any other issues. Thank you very much.
Thank you so much. Looking forward to getting that information and to hosting a great orientation.
Thank you, Dr. Maddie.
Thank you, Linda. Our next committee report is from Academic Public Health Collaborations Committee. I think that's Craig.
Good morning. First of all, I do once again want to acknowledge the pioneering spirit that Dr. Ross had. I remember many years ago, his promotion of that. That's very important as we work in terms of the academic health department and the efforts that Dr. Mahdi and Dr. Khan have engaged in are so critical. One of the things that is happening right now with the academic health department is a movement internally, both in city and county, with regard to looking at the learning needs assessments in both public health departments, and then specifically with the city for a workforce development plan so that we can move that forward. Another piece of that, of course, is the fact that Spring Schmidt, once over at St. Louis County Department of Public Health, is now with the Missouri Center for Public Health Excellence. She is also spending some time at St. Louis University, which was one of the partners for the Missouri Foundation for Health supported effort that we have. And yes, both she and I and many others are so interested. I know Dr. Mahdi's been working on this with regard to our other great institutions, some of whom are represented here on this board. Of course, over at Washington University, we also have UMSL, and I'm going to miss some of the others, but very important to have all of those connected. But currently, right now, we are focused specifically on the internal professional development for our staff and that workforce development plan as we look forward to the reaccreditation efforts of both St. Louis City and St. Louis County. That's my report. Thank you.
Thank you, Craig. Are there any questions? So I have a question, and this might be something that I should know, but do you have a board member who also assists you or works with you on this committee? Because I noticed that you always give the report, and I want to understand how we should be involved or could be involved for this specific committee.
Right. So both Dr. Ross and Dr. McBride have indicated a very particular interest in that, and my expectation is that that would happen. We have tried to put schedules together in the past, but I expect with Spring Schmidt and then with Dr. McBride and Dr. Ross that we can make that happen.
Okay. Thank you. Thank you for illuminating me because I wasn't sure. Okay.
We're going to do better.
No, you're doing fine. I just want to make sure I'm up to speed. All right. Our next committee report comes from the Health Communication Committee.
Good morning, everyone. We're a committee in search of work, and we might not need to do anything at this point. Dr. Mahdi's really strengthened the communications function of the department by adding, among other things, Jasmine Franjul. Jasmine, I apologize for not pronouncing your name correctly. She's been a social media intern from the CDC who has done a tremendous job helping Harold and Kim. And also the STL TV agency has been awesome in working with our communications function team. So I've been sitting in sporadically on their weekly huddle meetings about communications that are going out about our various programs in the department, but we haven't had a formal committee meeting of the board for a long time. in part because I'm not quite sure what there is for us to do. But Harold brought up a good idea that we wanted to put out to you all and see what your comments are. That it might be useful to develop a process of review whereby board members can weigh in periodically on communications that are being drafted by our collective communications team to give us their thoughts on the appropriateness and the effectiveness of, draft posters and white papers and press releases and video bits that are going out, which are excellent. I know they're excellent, but we also know that within each community, be it Bosnian or Hispanic or Vietnamese or African American or whatever, Afghani, we can always probably weigh in on, is it clear? Is it compelling? Is there a call to action? Is it in a language? Are there too many words? Do the colors confuse us? So the point is, what are the other board members' thoughts on this? And you would not necessarily have to be a member of the standing communication committee, but you could periodically be sent some PDFs or something and give us some feedback. This is just a suggestion that Harold and I were interested, and Dr. Mahdi were interested in your reaction to, in attempts to put more juice into this committee.
Thank you so much, Lisa. Sorry, go ahead, Dr. Ross, I can go ahead.
I was going to say, I agree with Dr. McBride and the fact that you've been so successful that you've excelled, and now you have to step back and say, whoa, we've done it. That's just remarkable progress from where we were 3-4 years ago. So I think that's just outstanding. I think it's important that we get, when we talk about communication, the most important group to contact would be the end users of that, the people on the ground, the community. They're the ones who are communicating with. And so I think we have to have a mechanism for really getting that input into this communication team.
Thank you so much for Dr. Ross. I couldn't agree more. Lisa, thank you so much for such a thoughtful report. I did want to take this opportunity to thank Harold and Kim, who have been with the health department for so long. Kim, who actually put together the city and county joint initiative slides. You can always tell when Kim has her hand on something because the infographics and the visual is just beyond. Her and Harold have really held down the fort for many years. Jasmine Frangel, I'd like to introduce and help her, unmic and say a quick hello. One correction is she's actually not an intern. She is a full-fledged PIO with an extensive history in communications and a passion for social media. If you have taken some time to just see what has happened on our social media, Kim and Harold were able to get us to over 200% increase in engagement on all of our, on 2 out of 3 of our platforms. But we have seen huge increases in engagement to the point of Lisa and Dr. Ross. And then Jasmine came in and has brought such innovation, such thoughtfulness and intention around education and communication. So just wanted Jasmine to get a chance to say hello to everyone. She'll be a fixture here. And then you can say a little bit about what you're doing, Jasmine, and some of the things you're excited about doing moving on.
Thank you. Thank you, everyone. Goodness, I wasn't expecting to have the spotlight on me today, but I appreciate it. Thank you. Yeah, I just think, it's been a wonderful experience so far. I mean, I just started in mid-February and was able to jump right in, and I appreciate being received so well by Harold and Kim, and we've quickly been able to form a very just collaborative approach to getting things done. And also Dr. Mahdi has been amazing, just embracing all of ideas and changes. And so it has not been a difficult place to come in and start working. So I appreciate that. And I think just overall, I agree with, what everyone is saying in terms of, moving forward, it is going to be interesting to see what the community also expects out of the Department of Health in terms of, what they want as far as communications is concerned. And also we just have discussed kind of just like what the demographics are currently in the city and how we can improve and address all of the different groups moving forward as well. So those are conversations we've had. So
Thanks so much, Jasmine. And so there's been a lot of organizational infrastructure that Kim and Harold have brought in, a lot of partnerships with the press that have yielded really good press releases. Harold has taken a leading role around STL TV. You'll have noticed a lot more videos with me in them. It feels very obnoxious from me, but we're trying to hit the different ways that people absorb and learn and communicate. So this is just a fantastic team of three. Their strengths really work well. So I'll stop bragging about my team. But to Lisa's point, I think the next step will be to really figure out how the committee can continue in supporting. Lisa's being very humble. It was her push and willpower and that of the committee that got us and the survey that we did for the city across the threshold. I think we need to look at it, make sure that we're utilizing that well and start to address next steps. So I think that will be a great place to move from. I see Colleen has something, so I'll hush now.
Thank you, and thanks to the committee and the folks who are doing all the great work. To Dr. Ross's point, is there a mechanism by which we're using, are people responding to our social media and then getting a response back from us, or are we using it mostly as sort of posting content, updates, policies, or are we using it interactively with patients? But not patients, sorry.
You sound like me, Colleen. That's a slip I make all the time. Kim, could you address that question? I think you could get some good perspective here.
Sure. I think it's a little bit of kind of multitude of responses. If we're able, if it's a question that they're asking for additional assistance or a question about how to secure services that the health department provides, we'll reach out, we'll contact them either through a comment in that thread, or we'll reach out to them via direct message. On Facebook, Twitter, we can DM them. If it's something that is maybe critical, we sometimes will take it to us a kind of a second look at it. We may even discuss it as a team of, do we want to respond, or could a response possibly create more criticism? We are a government entity, and not everybody's going to be happy with us. That kind of comes par for the course with any service provider. But we also do want to help those who are seeking additional services and connect them to those services as much as possible.
Yeah, I mostly ask one because I think it ties to what Dr. Ross said, but also active monitoring of social media is difficult for a team of three. I mean, that's that is
acknowledging that, Colleen. Like, what they do is amazing, but what they do, being that they're just a team of three, is incredible. But one of the things I love about your suggestion is that there are interactive ways, polls that we can do online, simple question and responses that we can do that kind of stay away from the trolls nature of, we're always welcome to criticism as long as it's constructive and respectful. But we as other entities are open to a lot of abusive sort of a commentary as well. So we want to foster engagement that can do that, and that it makes it easy for them to do. So some of the polls that are built in can immediately give back data that wouldn't overwhelm the work that they're already doing. So I love that idea, just other ways. And you and Planned Parenthood are an example of how we were able to branch out, and we do partner posts as well for education. So we've done some stuff around sexual health together already and look forward to continuing to. So I think that'll be great.
Okay, are there other questions for the Communications Committee or comments? If not, we will move to our next agenda item, Departmental Updates. Dr. Mahdi, you're up again. You're on mute.
Child. So I was going to share screen again, but I remember this is not a share screen portion. So a lot of good things happening in the department right now. One of the big things that I'd love to report is workforce development. I've been very intentional. And I said something today on my social media platforms. I spoke to 150 public health students yesterday at the Brown School. They wanted to hear about public health leadership during the pandemic. And one of the things I said that was important to me as a leader is to address the health of the department within before externalizing, my agenda and response. And I believe that that has been really fruitful so far. We still have a long way to go. So we have hired 20 people, and that doesn't even reflect the people just in the last week that I have offered positions to since I started in October. The turnaround time from job posting to people being in the health department was 5 to 6 months. And in less than 6 months, we've been seeing people hired in a 2 to 3 month turnaround. I believe that we're only going to get better. This has been through intentional meetings and relationship building with the Department of Personnel, but also internal professional development around how we can be more attentive to the needs that we have to do to make this happen. So we're still limited by salary. A lot of times I pick up the phone to call to offer someone a job. They're excited. Oh, I follow you and I would love to work for you and your team. And this is an exciting time for public health. I tell them the salary and they laugh and get off the phone. So you may have heard from the mayor's State of the Union that she has pledged to increase salaries in the city soon. We are really looking forward to that because I hope that it will allow me to be even more aggressive in those pursuits. The thing that is kind of breaking news that I'm very proud of is that the visit with Dr. Walensky has yielded a lot of great results. As you know, and I've reported here at this group, I have asked for support from CDC National on a couple of different fronts. First, among those, workforce development. They have met with me 3 times since she has left, and she really, was responsive to her promise. And so we have been given 6 different ways that we can apply in the long term over the next 2-year period for workforce development through the CDC, through different avenues. I did tell them I need a short-term response too, as much as possible, so really push that angle. And so they have pledged to give, to work with us to get 4 to 6 fully paid for, full benefits through the CDC people to work with us within the health department on priority areas. And that'll be as early as June or July. So it's slow, but it is something. And more importantly, it's opening avenues to high level relationships, St. Louis really being part of the map and having access to those folks. And with that and the conversations I told you about at the state, I'm very hopeful about that. So the first section that I would report on is epidemiology. And the big news there is we have almost filled we are 1 spot down from filling the entire epidemiology bureau, which is a phenomenal feat. We are able to do a lot around data right now, and I'm extremely excited. Environmental health services are still struggling by way of workforce development. This is a harder area to recruit for. Salaries are very low and the work is very hard. But we have made some progress just in the last month, having offered 3 new positions there as well. I'd like to report and congratulate if Tanya Madden is on the call and is able to come on camera. This woman has led the department through 2 very high level audits, both of which were extraordinarily successful. A lot of challenges, a lot of work. One of the quotes that I thought was really important to share is the HRSA, child, I've been talking too much, I'm losing my English. The HRSA site visit happens every 4 years. One of the things that they gave us by way of feedback was they cannot remember a time when they've seen a health department make such big improvements during that time, specifically within the last year. Than they've ever seen before. And that I thought was a huge testament to her leadership and her team's work. So I just wanted to let Tanya just say a few words if she wants to, or just for us to just clap and celebrate that, because these were some very successful site visits. So Tanya, anything you want to say?
No, I'm just glad that, that the site visit went fairly well. I mean, it was a tough site visit, no doubt, but I think just the progress that we've made over the couple of years that I've been here has been definitely a work in progress. So I'm just so glad for Dr. Mahdi and the city that the program is continuing and that HRSA feels like we're doing good work you know, especially with Dr. Marty's leadership. She was right there in the mix with us and leading us on. So I just really appreciated that.
Thank you so much, Tanya. Really appreciate it. So from the fiscal staff vacancies, we have almost filled our fiscal department. We have interviewed, we've got 2 more slots. One person just won't answer their phone, but if it wasn't for that, I would say 1 slot. So that's for the accounting manager position and 2 accountant positions. We just had a lateral transfer to fill the Ryan White accountant position, which has been complete. So Emmanuel has been busy training, but I really want to thank him for the void that he filled during a time where we were down to 1 accountant. And Emmanuel, you'll often see Emmanuel here early in the mornings, late at night, here on weekends, has done a lot to really improve the organizational infrastructure and communication with external partners. And we've seen some real improvement there. The preliminary review of the FY23 budget was complete and submitted to the budget division on the 12th of April. I'm hoping to have some good news for you around that. I was told I broke the record for a director that asked for more money than any other previous director in the city. That was met with a few chuckles, and I said, well, it may be funny, but I still don't have, that is still just putting me at foundational level health department. So that just goes to show how much the needs are, but I'm very appreciative to the budget division and the mayor's office for their support in supporting my vision for really growing the health department and meeting some critical needs. So I'm hoping to have good news for you there. We have debuted a new accounting system. The new Oracle accounting system was implemented on March 1, is going well. Fiscal staff are learning the new system. And it has really helped us to be able to move things forward much faster. And there was the fiscal department was a part of the Ryan White and Hopworth grants that were completed. I want to thank Emmanuel and his staff. It was a lot of their change and a lot of their push that made this a successful site visit. So thank you to the fiscal department for their work, and to Emmanuel for his leadership. From a government services analyst perspective, we prepared materials for independent team to score 7 proposals submitted in response to RFPs for a summer youth programming service in 8 St. Louis public schools in area of needs. Craig has been phenomenal in leading this charge, and we're very excited about what that could yield. We continue to see leadership and support as part of teams for the city and St. Louis Department of Health planning and implementation of 4 assessments that are part of the region's community health assessment, and told you a little bit about that earlier. We followed up with policy initiatives, including material for a letter of support from me to get the Lead Out of School Drinking Water Act, a really important initiative. So we're hoping that that moves through. And last but certainly not least, from our CD and WACA divisions, the STI initiative, we've had some data that we've presented to our partners, Planned Parenthood, the county, Affinia, and the Spot, around the noticeable increase in STIs, specifically in syphilis, across all partners. And so we're all seeing walk-ins now, and we're seeing more walk-ins now than we did in the pre-COVID area. And so we're hoping that we can start to address this in a very assertive way. Our Women, Children, and Adolescent Health submitted a draft MOU to the Department of Health Contact Compliance Officer with homegrown STL to include potential funding to expand the work done by both entities focusing on Black men. They have resumed lead and asthma education outreach in the community. I've been really looking forward to this. One of the most enjoyable parts of their job is just being in the community, and COVID really took that away, which was difficult. So we're so glad to see them back. I'm thankful for them and their leadership in making sure that I was aware and therefore invested in supporting the work of JAMA Birth Village for Black Maternal Health Week. They were able to showcase their work. We honored them with a proclamation from the mayor's office, and it was because of the team's leadership that that connection was made. And so thankful for that. They're having focus groups with KSA within the next month around maternal child health. And there's a new men's health partnership with Black Men Build St. Louis that they're excited about building. The disease investigation is monitoring the COVID cases with that slow but steady rise closely. From an HIV prevention standpoint, there's a new collaboration with Black Men Build St. Louis with which is a condom distribution site. The health stop is getting digital screens. Very excited about progress and technology there, and preparing for the first in-person Pride Fest since 2019. Cannot wait to see where we land there, and looking forward to a really strong showing from the health department. So I'll stop there. I see Brenda Thomas is on the call. I'll ask her if she has anything to add at this time. But other than that, that is all I have for you by way of report.
Yes, I actually do have something to add. Dr. Madi forgot to mention that the National Coalition of 100 Black Women has nominated her to receive the Health Award this Saturday or next Saturday at the Women's Empowerment Hour. So congratulations, Dr. Madi.
Brenda, that's why I'm not calling on you ever again. See, you have now made sure you will never be called on again. But thank you for that recognition, Brenda, and for saying that. You know, I would have never said it. So thank you.
I know, that's the only thing you missed.
Thank you so much.
And I'm sure our communications team will be ready with pictures and all sorts of things to get it on social media.
People are tired of seeing my face, Colleen. We're gonna give the people some reprieve, okay? That's all I have.
There's no such thing as seeing too much of your face.
All right, thank you, Dr. Marty. Colleen, you have your hand raised. I don't know if that was from a previous, okay.
Sorry, that was
All right.
previous.
Okay, so do we have any old business that we need to discuss? Looks like we don't. Any announcements? I actually have one announcement. I'm gonna see if I can share this. So Children's Mental Health Awareness is coming up. There's actually an event on May the 7th that features several partners focused on activities for children and families with an emphasis on helping young people understand social and emotional wellness. There'll be food, giveaways, activities, guest speakers, young people who have experience with mental illness, talking about their journey and offering support to others. So if anyone does not already have a Children's Mental Health Awareness Day event planned, this is an opportunity to lift up and support one that is happening in the community, and it will happen at the Deaconess Center for Child Wellbeing. So there will be plenty of space to social distance and participate in this particular event. Any other announcements? If not, I think we can move for adjournment.
Move adjournment.
We have a second? I don't think you actually have to vote to adjourn, but
No, you don't.
Thank you. So we are adjourned. Thank you, everyone. The next meeting will be on May the 19th.
Madam Chair, you did a phenomenal first meeting. We are so excited to have you. Thank you, thank you, thank you.
Thank you.